Please take your seats.
Prenez place.
I request that you take your seats, please. We would now like to give the floor to Angola. Angola, you have the floor. Thank you very much, Mr. Chairperson. Distinguished delegates, ladies and gentlemen, Angola receives and welcomes the proposal for the implementation of the global strategy on the prevention and control of cholera by member states, which prioritizes interventions, actions, targets and milestones for the reduction of mortality and morbidity associated with cholera until 2030. In Angola, about 60% of the population live in areas that are peri-urban or in slums, and they have very limited access to drinking water in their premises. There is a lack of sanitation infrastructures, and they live in quite precarious situations, especially with regard to hygiene. So this often results in the spread of cholera in various regions of the country, and it creates a serious challenge to public health and obviously has an impact on development. Besides this, rapid and unplanned urbanization that we have observed in the country, as well as the intensive and extensive internal displacement and migration of people, both Angolans and people from other countries into our country, do have an impact on the livelihoods of these communities. Currently, Angola is facing a new outbreak of cholera, which started in December 2017. And amongst various interventions, we have a national response plan that has been focused mainly on multi-sectoral coordination, epidemiological surveillance, detection and distribution of safe water, as well as various sanitation and hygiene activities, as well as communication with the population regarding the risks. However, due to the fact that we have lack of qualified personnel in the peri-urban areas, as well as lack of financial resources, it is very difficult for us to carry out activities in the more complex areas, and this does cause problems with regard to the monitorization and evaluation of all the activities that are carried out in order to control the epidemic. Due to the fact that Angola still faces various challenges, especially with regard to the quality and limited use of epidemiological data, as well as the very few actions regarding research and other investigation with regard to the behavior of the disease, we would like to welcome and congratulate the various actions that are proposed in our document AFR R68/7, and we'd like to ask the WHO to advocate various partners and stakeholders, especially with regard to the laboratory capacities of the country, so that we can focus on research and development, as well as to strengthen the various capacities and skills in member states so that they can actually detect epidemics of cholera before they occur. Thank you. Thank you very much. Now we'd like to give the floor to Nigeria.
Thank you, Mr. Chairman. Let me join my colleagues in commending the regional director and a team for this initiative, the regional framework for the implementation of the global strategy for cholera prevention and control, 2018 to 2030. I must admit that I also share their comments that the document is well prepared, quite detailed, and I'm one of those who believe strongly that if well implemented, we can actually eliminate cholera in Africa. I think what we need is for the regional director to implement a policy to eradicate cholera in Africa with a time frame. And I think it can be done even before 2030 if this is well implemented. I believe that the issue of cholera is beyond health. We will need intersectoral collaboration with water resources, environment, education, as well as information. And the two key factors are known: the issue of effective and safe disposal of waste and provision of potable water. If those two are taken care of, I think cholera could be on the way out of Africa, and it is doable. We want to appreciate the opportunity to intervene during this discussion, and we are in support of the regional implementation framework on cholera prevention and cholera and control, including the priority interventions that are listed here. Mr. Chairman, distinguished ladies and gentlemen, I must really disclose that we are already implementing many of the actions that are proposed within the framework. We've carried out risk analysis, mapping, and profiling of the different areas in the country that have experienced cholera. And we've also established cholera emergency operating center to do surveillance. And also we are collaborating with our neighboring countries, particularly with respect to sharing information, particularly with respect to cholera outbreaks. It's quite important to also highlight the need to make sure that we provide water to our people, we educate them, and that cholera is not really due to witchcraft or any other extraneous factor, but there are factors that are essentially within our control. We've also established technical working group comprising stakeholders to provide oral rehydration therapy at no cost to affected individuals. We train communities on basic hygiene, and we have provided funding for control of cholera in the country. We also want to disclose that we have institutionalized reporting processes, and we believe that if these are fully sustained, truly, we will be on the verge of eliminating cholera. We want to appreciate you once again, Mr. Chairman, and I thank you for the opportunity to intervene. Thank you.
Cameroon has the floor. Thank you very much for giving me the floor so that we can express our position with regard to this document. It is the first time that Cameroon takes the floor. I am the director of the Center on Epidemics and these diseases, and our delegation was led by the ambassador of our country for a while. I would like to express the apologies of our head of delegation that could not be here. I would like to say that the work that the Secretariat has done with regard to this document is very good, and I'd like to highlight that. And I would like to encourage the Secretariat to go even further, because we are convened here and we say many things, but we actually need to summarize that which is said and transform that which is said in documents that can be read to the world. I believe that we are all in agreement, and so it's not necessary for us to all repeat the same things. So first of all, we just need to say that cholera is a large epidemic. Secondly, it is an important indicator of poverty. And thirdly, it is a disease that affects many sectors. So it has a multi-sectoral nature, cross-cutting nature. And so these are things that are said by many doctors and as well as many ministers of health. The Secretariat needs to use all its intelligence to take note of various issues together with me. And there are various questions that can be asked. First of all, are we focusing sufficiently on the multi-sectoral nature of cholera, because what happens is that when we go to the field and we observe cholera, we realize that despite what we say about the cross-cutting nature of cholera, the only ministry on the ground is the Minister of Health when these epidemics happen. And so the cross-cutting nature of cholera isn't really understood. We don't convince other ministers and other ministries that in fact it is a cross-cutting disease. So it's very important for us to also identify what are the roles the other ministries and other stakeholders can play. It's important for us to communicate that message, and we need to ask ourselves whether this document actually transmits that message sufficiently. It's also important for us to focus on the consequences of cholera, but as I've mentioned, there are only three main issues that we should focus on with regard to cholera. Then everything that we said with regard to the indicators as well as the targets, all these have to be implemented by the Ministry of Health. I repeat, all the indicators here have to be implemented by the Ministry of Health. Isn't it possible to find a space so that other ministries also include their own targets so that they can feel involved and engaged? For example, in terms of the first targets and milestone, we say that it's important to have focal points at national level until 2019. I think that it's important for us to ask ourselves what we mean by a focal point, because here I think what's going to happen is we're going to assume that it's the Ministry of Health that's going to be the focal point. But I think it's important for us to transmit the message that cholera is first and foremost a poverty problem. And so it would be important for us to take the cross-cutting nature of cholera into account in all these targets and milestones, to see that actually some of these milestones and targets don't or shouldn't actually depend on the Ministry of Health. For example, besides one or two targets, everything else depends on Ministry of Health. For example, the mobilization of resources, sensitization campaigns, awareness campaigns. I think that we should actually involve other ministries in this area. I don't know if you're understanding me, but I know that Secretariat normally understands our heart, and we often say many things at the same time, but it's important for us to ensure that the multi-sectoral, cross-cutting nature of cholera needs to be clearly transmitted. For example, we should be able to say here what the Ministry of Water and Sanitation needs to do, what the Ministry of Agriculture needs to do, and we need to specify these targets and milestones that they can achieve in very clear ways, because at the end of the day, in all our countries, we have got water and sanitation distribution pipelines. And so what happens if there's an explosion of one of these pipelines? It's going to mean that one of the districts is not going to have water. If at the same time there's a cholera outbreak, what is going to happen? The Ministry of Water is going to have to get involved. They're not going to think about cholera. They're going to be thinking about the fact that they need to ensure that water and sanitation pipeline. So it would be very important for all the other ministries to feel engaged in our countries, because in the African region we have got various structures, such as, for example, the African CDC. But I don't see what is the role that the African CDC is going to play here, because the ministers of health should be talking about cholera, but they don't speak about how to involve other ministries. And so it would be important that we ensure that all those ministers can be convened, and that all the ministers actually take cholera into consideration. Now, with regard to the WHO actually has the same problems that we do. They talk about cholera, but at the end of the day, I think that there is a problem with communication. For example, in this document, I see that you refer to UNICEF, but what is UNICEF's role in this? We're talking about a humanitarian crisis, and there is a United Nations system and all the other United Nations agencies that are brought together through a cluster approach. But we don't mention any of these here. They are not engaged. They are not involved. So, for example, we speak here about the refugee camps, the displaced persons camps. So where is the WHCR? Where is the UNHCR in this? I think that when we talk about cholera in refugee camps or displaced persons camps, we should be talking about UNHCR and its role. And then, for example, we mentioned migrants and an increase in migration. For example, certain measures were taken at the airport to carry out the detection of people arriving in the country. But, for example, I don't think that at the airports they think about the fact that people could arrive with cholera or they could arrive with multi-drug resistant TB. So, I think that cholera is a cross-cutting issue, and I think that it's important for us to bring in the United Nations and all the other agencies, because cholera needs to be put on the agenda of the United Nations. And we need to be absolutely convinced of the fact that epidemics are health problems. They are priority health problems. They are highly dangerous. They create, they are just as important as our defense and our security. And so it's important for us to place cholera and all these diseases at the top of the agendas of our country, of our regions, and of the rest of the world. And so it would be important, I believe, that we review this message, especially when we're dealing with epidemics. Thank you. Mauritania, you have the floor. Thank you very much, Mr. Chairperson. I would like to thank the Secretariat for having prepared this ambitious vision document that aims to face all these challenges. I believe that this is a well-prepared document, and I'm taking the floor to ask for some clarifications. Actually, my contribution is actually more a question regarding this document. I'd like to know, with the experience of the WHO, especially with regard to acute diarrheal infections, are we going to make cholera a priority program in our country? So I'd like to know from the Secretariat what exactly is the status we're going to give cholera. I'd like to know whether cholera is going to be seen as one of the priority axes of our fight against communicable diseases. I'd like to hear the Secretariat on this matter. Besides that comment, I'd like to say that I believe the document has been well prepared, and it seems to me that the eradication of cholera should actually have specific strategies and goals and targets. And so for that, I'd like to thank the Chairperson and the Secretariat for the very good work done. Thank you. Uganda.
Thank you, Chairman. Uganda supports the regional framework for implementation of the global strategy for cholera prevention and control 2018-2030. As all of you know, cholera has remained a major public health problem, mostly affecting poor communities with low socio-economic status. And the most vulnerable population are those residing in overcrowded with limited safe water and sanitation services. And this include refugees and immigrant populations. In Uganda, regions located along the country international borders and those neighboring the Great Lakes are responsible for the majority of the reported cholera cases. As a country, in 2017, we launched the National 5-Year Strategic Plan for Cholera Prevention and Control, and this plan is aligned to the World Health Organization roadmap for ending cholera by 2030, with the objective of reducing cholera incidence among vulnerable populations by 50% by 2022, in preparation for the global roadmap to end cholera by 2030. Uganda supports the priorities detailed in the framework, which propose concrete actions. And the Uganda government has provided the necessary political and financial commitments, coupled with community engagement, participation, monitoring, and evaluation of implementations. Uganda recognizes the role of the WASH strategy. However, beginning this year, in January 2018, the government started complementary use of oral vaccines for the 11 cholera hotspots districts. And this we anticipate to vaccinate about 3,600,000 persons. However, all of you know that among many other challenges, the key which come are really the inadequate response based on cross-border outbreaks. The national interventions are usually limited, yet outbreaks occur on both sides of the border. Displacement due to conflict. A cholera outbreak in northern Uganda in the late 2016 and western Uganda this year followed an influx of refugees from southern Sudan and the Democratic Republic of Congo, respectively. The other aspect which we definitely were be cognizant of is the advanced weather conditions, which normally lead to contamination of water sources and the destruction of sanitary facilities. Mr. Chairman, Uganda endorses the actions in the framework and supports it. Thank you very much.
Thank you very much, Mr. Chairperson, once again. On behalf of His Excellency, the Minister of our country, I would like to thank the Chairperson, and I'd like to congratulate you, Chairperson, for your election, and I'd also like to thank all the Vice Chairs for the way that you are chairing the meeting. And I am the head of the delegation of the DRC. I'd like to congratulate the Regional Director and the entire AFRO team for the organization as well as the warm welcome that was provided to the DRC delegation on our arrival. Cholera is an important disease, an epidemic in the DRC, and it is endemic in certain regions that are often or that receive a lot of rainfall. Currently, our country has got 2 cholera epidemics, one in the border region between the DRC and the Congo-Brazzaville along the river, and the other one is in the Motifera-Bushimai region, where we have 1,400 cases already detected. Besides this, we also have the Ebola virus disease. Due to these emergencies, our minister could not be present. Since 2017, our ministry developed a national program for the eradication of cholera as well as other diarrheal diseases. And this program, together with all our partners, allowed us to also develop a strategy plan for the elimination of cholera. And this strategy is based on the global strategy of the WHO, and it focuses on 3 important axes or pillars. First of all, the prevention pillar. Through this prevention, our national cholera prevention program works closely with the other ministries in order to ensure that prevention communication is provided. And then there's involvement of the communities as well, ensuring that we transmit messages regarding the washing of hands. And we have adopted a multi-sectoral approach together with the Ministry of Water and Sanitation in order to intensify the distribution of drinking water throughout the country. The second pillar is the treatment. So there we don't just focus on the strengthening of the capacities of all our health staff that provide the dispensing of medicines and other health equipments, but also they focus on the epidemic areas, and we have various CTCs, so cholera treatment centers, and we provide them a minimum package of activities that ensure the access to quality medicines and other equipment in order to ensure the reduction of morbidity and death. And then the third one is the focus on the epidemiological surveillance of all the profiles and all the sources of cholera throughout our country. So there's a lot of study and research on the ecological side of cholera. So through all of this, the DRC is basically trying to say that it supports the regional strategy for eradicating cholera, and we would like to say that it's important to focus on the multi-sectoral nature of cholera, especially along our borders, and that it's important for us to strengthen the entire health system in order to ensure a long-lasting solution to this disease. Thank you very much. I'd like to give the floor to South Africa.
I'll do it from here. Thank you very much, Chairperson. We thank the Secretariat for the regional framework and fully agree that poor socio-economic conditions and unplanned urbanization are major facilitators of spread of cholera. This clearly means that the health sector alone will not be able to deal with the disease. The health sector will receive patients after they've already been infected. And these patients are casualty of poor access to clean running water and sanitation, but above everything else, poor or non-existent human settlement planning. Asking poor people with no access to clean water and soap to practice safe hygiene will obviously not work for us. To deal with the root cause of cholera needs a whole government approach to ensure that clean water and sanitation is prioritized, because we all know the issue of clean water and sanitation and human settlement are obvious social determinants of health. While we agree with the very ambitious targets and the milestone in the framework, it is clear that will not meet these targets without, number one, a strong health system, number two, a multi-sectoral approach, and number three, the necessary finances. In South Africa, we have discovered that it is not sufficient only to develop new water and sanitation infrastructure. It is also vital to maintain the existing infrastructure. Unfortunately, this responsibility is the function of local municipalities in my country, and many of them are very weak. This means they need strong support from national government to ensure that water and sanitation infrastructure is functional, which means that we need not only public health officials, such as environmental health practitioners, but we also need qualified engineers and town planners. Again, this highlights the need for a multi-sectoral approach and implies that development, implementation and monitoring of national cholera control plans must be through a multi-sectoral structure. We therefore call on WHO to work with agencies within the UN and other partners at global, regional and country level to support countries to ensure that their national cholera prevention and control plans reflect the multi-sectoral approach, as the health sector working alone will not be able to cope. Chairperson, many a speaker here has emphasized this issue of multi-sectoral approach and cross-cutting nature of the fight against cholera. I was listening at our colleague from Cameroon. I realized that he's very anxious as to whether we indeed understand him. I can assure you, colleague, that many of us definitely do understand you. Whenever health issues, Chairperson, get out of control, we usually call over heads of state to take the lead. It happens with HIV and AIDS at UN. It happened with Ebola. It happened with NCDs. And next month is going to happen with TB. And my suspicion is that we might be underplaying the problem of cholera. But I believe the time has arrived that it be given the same status as one of the member countries he has mentioned. Even if it doesn't happen at UN, definitely on the African continent it must happen. One of the main reasons is that urbanization and massive movement, migration across the borders is happening at such a fast pace that one day we'll wake up with a disaster in our hands. In conclusion, Chairperson, I want to mention something that impressed me immensely during the floods of 2000. You'll remember that there were massive floods which engulfed Mozambique, South Africa, and most of southern part of Africa, around the countries in the year 2000. I attended the workshop where a very powerful town planner put up the following scene. He said, usually, when human settlements are going to take place, there's a pattern. Three things happen, and in that order. You plan the settlement, you build, and you occupy. And he said in most parts of Africa, it happens in reverse. People occupy first, then they build, then they plan later. And he said that's where our problem is. And so when we put heads of state to take the lead, we'll tell them to follow that pattern. Please plan first, then build and occupy. But go to many informal settlements. They were all occupied before any building and before any planning. And I think that speaker was right, and this is what we are faced with here. So I'll support those who are saying the matter must be elevated above ministers of health. Thank you very much.
Thank you very much. Mozambique, puis on va terminer par la...
Mozambique and finally Sierra. Thank you, Chairperson. I'm taking the floor first to say that Mozambique approves the regional framework for the implementation of the global strategy for cholera prevention and control 2018 to 2030. The basic elements have been presented by those who spoke before me, and I won't repeat them because I agree with them. But I would like to say that a lot of the items contained in this program are already being implemented in Mozambique. But I wish to highlight the fact that we're in the process of setting up the cross-border committees with neighboring countries with a view to developing and implementing joint plans for the prevention and control of cholera. This is a joint initiative with NGOs and health sector partners, in particular the World Health Organization. With regard to case management, Mozambique has made considerable progress with a reduction in the mortality rate. The WHO in Maputo has played a key role as a frontline partner of the Ministry of Health in the control of cholera, and so we were able to reduce our mortality rate to less than 0.5%. A lot of activities are ongoing, which we are carrying out with the other partners. But once again, I would like to highlight the fact that we have set up and activated multi-sectoral committees, because cholera requires a lot of cross-cutting action, which involves in various sectors at national, provincial, and district levels in fighting cholera and controlling outbreaks under the leadership of the government. We also have the community involvement. We use community leaders, as well as traditional health, traditional healers. Finally, recently Mozambique approved a program for water supply in all rural areas that did not have water. This was a matter that was discussed recently in Cabinet, and it will soon be implemented. We believe that with this activity, there will be a positive impact on the reduction of cholera as well as other diseases. Thank you.
Merci. Et la RCA.
Thank you, CAR. Thank you, Chairperson. It's not to my advantage that I'm the last to take the floor, because the previous speakers have already mentioned everything I would have wanted to say. But so I would simply like to add my voice to all those who spoke before me to thank our Secretariat for the support given to the countries, and in particular to my country, which on account of its situation is at risk of cholera and other outbreaks. This document has mentioned rightly too the fact that conflict is one of the determinants of cholera outbreaks. We're happy and proud to say here that our organization is working with us where we have cholera outbreaks and given our difficult situation. Nonetheless, Chairperson, it seems to me that we have come to a point of tension which has been coming up recurrently, not only today but in all our interventions, and this has to do with the multisectoral nature and multidisciplinary nature of health. It is a recurrent theme, and so the question is, when are we as states and our organization going to match our words with action? It is clear that the WHO's position is that health is about physical, mental, social well-being. It is not only the absence of disease. And we get the impression that this definition is not reflected in the way we operate. So we have got to a point where it is constantly catching up with us. Cholera, Ebola, everywhere. And I am sure that what will come up later will also bring us back to this whole problem of multisectorality. So my question, Chairperson, is when is our organization going to come out of this situation, this ivory tower, this situation of powerlessness? I know that we're going to talk about primary health care, but it is really important for our organization to envisage, at least at regional level, how it's going to take the bull by its horns. Why don't we consider the regional committee inviting the ministers of finance, urban planning, etc., to their meetings? It is on this note that I wish to stop, Chairperson. Thank you. Thank you very much. Now I'll give the floor back to the Secretariat. Generally, the document has been supported, but the matter of the multisectoral nature of health has come up again. So now you have the floor.
Thank you very much. I think we do appreciate so much the extraordinary interest in this document. 19 delegates were able to give their views on this, and as the chair says, most of them, all of them are supportive. So we are really happy with that. Allow me summarize some of the key themes into 7, because 7 things have really clearly come up, and some of them have been repeatedly said by the delegates. Number 1, the issue of cholera is beyond the health sector. The multi-sector actions to address the risk factors to prepare for and respond to the outbreaks. This is an opportunity for us to have stronger multi-sectoral approaches, stronger partnerships among agencies, among organizations. So I think this is quite key. We'll highlight this. Number 2, the issue of having strong political commitment. I'm going to use the word stronger political commitment. I know we all really acknowledge that we have political commitment, but we need more commitment so that we provide the required coordination, if possible, over and above the ministerial level. Many countries share the experiences saying that it would even be good to raise this to the level of the president and so on. So these are very practical things. This helps also to get the necessary resources required, including financing. Number 3, what I've clearly had is more emphasis on prevention. We had so much in the past emphasized treatment. Now we need to really look at the risk factors, and this goes well with the whole government approach and goes well with mapping the health sector, mapping where the cases are, and then digging deeper into why those cases are occurring there. Therefore, health providing that very important data which drives the multi-sectoral actions. This is in line with the SDGs. There's no way nobody can do this alone, leaving no one behind. Number 4, it has emphasized so much on, you have emphasized so much on regional integration, cross-border collaborations, especially the issue of information sharing, timely information sharing, and sharing of other resources. Number 5, emphasis was put by one country on saying that we have good strategies and plans. The problem is with the implementation. There are gaps in implementation. I think that's why we really emphasize that we need stronger political commitment and joint actions so that we collectively look at the issue of how do we implement these very clear strategies. Second last, I think we emphasize so much the issue of better risk communication. We link this to the prevention, including community engagement, and allow me here to highlight the issue of increasing urbanization in the African region, globally, but specifically to note the rapid increase in urbanization in the African region. Therefore, the critical roles played by the urban planners in the prevention. Let me specifically highlight the issue of the mayors, involving our mayors who are on the political side, but also they do have resources as well. So our historical cholera preparedness, which involves Ministry of Health and somehow Ministry of Water and Sanitation, needs to be extended beyond these levels. I think these 7 themes came out very clearly. I will not go country by country because they were really repeated. There were 3 areas for clarification. The OCV, oral cholera vaccine, and as clearly highlighted by the WHO recommendations and policy, OCV is complementary to the other interventions. If you just go for OCV, you miss the point. It's complementary. And indeed, WHO has highlighted, has recommended clearly when to use OCV. If you know that it's going to be impossible to provide clean water, sanitation, hygiene, especially among the displaced people, crowded, and you will see that risk, it is good to give OCV as well. So they have not recommended OCV for blanket use for mass vaccination as a preventive, but under some specific conditions. The second clarification was a suggestion that a better mechanism for tracking progress needs to be defined. And I think this provides an opportunity for us to explore possibility of working together with you to develop some scorecards to follow. Because as I said, we have set ourselves very ambitious targets, and this will go beyond, of course, health sector. And then the last to clarify was in form of a question: are we going to make cholera a priority program? I think this is to us at the national level. With this, we have clearly highlighted that we need to give a higher priority to cholera. We're using cholera, but we're talking about diarrheal diseases. Look at the number of children dying from diarrheal diseases. We have singled cholera, but around inappropriate water sanitation and poor hygiene, the number of people who are dying from preventable disease is very high. So it is worth giving cholera a higher priority than what we have now. I think with these few comments, Mr. Chair, I will stop there. Thank you.
Thank you. Je passe la parole toujours au secrétariat.
Secretariat still has the floor. Thank you, Chairperson. Just a word to take it from where the Honorable Minister of CAR left off on primary health care and universal health coverage. All the discussions will take us there, and it's just as well that in a few months' time we will have this international conference on how to revitalize community health care. Cholera is a matter of equity, and I think it's very important for us to consider this. It takes us back to high-level political commitment, no doubt, but as has been said, intersectoral collaboration is extremely complex. It would be very interesting for us to share experiences. Cameroon said a lot on this, and very often it's about prevention, not even allowing cholera to come up. Now, when we talk about collaboration and cooperation across sectors, very often it's limited to the national level. Already there, it is quite difficult. We have the Ministries of Water, Urban Planning, Infrastructure, etc. But very rarely do we address the matter at decentralized level. What do we do at province level and even at district level? It is only when we analyze it up to that level that we realize that primary health care is concerned. We are going to take on board all these additions that were made. For example, education. I think it is important that already at the schools, the children are taught to wash their hands in the framework of primary health care. During Ebola, we observed that just from hand washing, typhoid and cholera disappeared from those countries, Liberia, Sierra Leone, and Guinea. But then again, we need to ensure that those achievements are permanent. So in conclusion, we have networks of mayors, for instance, and also all the community groupings that can be used. So let us come back to this extremely important principle. And if we go back to universal health coverage, we will be able to tackle the problem of cholera from the root. Thank you. Thank you. Distinguished delegates, following these discussions, shall we take it that the regional committee is ready to adopt the actions proposed in the document, taking into account the various observations made? It is so decided.
Alors, comme sur le timing, il nous reste encore 35 minutes.
Well, we still have 35 minutes. Do you agree that we should go on to the first item on tomorrow's agenda on environmental health? Is that agreed? Thank you. But prior to that, 2 minutes for Dr. Felicita.
Right, we need some music because we want to really do some energetic things, yeah. Yes, we need to stand up and get the circulation going. Music, please. Mr. DJ, you are letting me down. We need some music here. All right, the music will catch up with us. We are going to go 1, 2, 1.
It might seem crazy.
Right, now we go to the music. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Dive, dive, dive. Check.
With the air, like I don't care, baby, by the way.
We were born in the age of twist. Come on, check it.
Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Yeah. Well, give me all you got and don't hold back.
Thank you very much.
I've asked them to bring out something. At the same time.
Merci beaucoup, merci beaucoup.
Thank you. Thank you.
Alors, comme adopté,
as agreed, distinguished delegates, We shall quickly consider agenda item 15, draft global strategy on health, environment and climate change.
Voudriez-vous vous référer au document?
May I refer you to document AFR/R668/12. This will be presented I'm informed by the Secretariat that this agenda item is tabled before us following the decision 5 by the 142nd session of the Executive Board, which requested the Director General, among other things, to ensure that the regional committees are asked to comment and provide input on the draft comprehensive global strategy on health, environment and climate change. I will now give the floor to Dr. Magaran Bagayoko, Acting Director for Communicable Diseases, to introduce this document.
Merci, Monsieur le Président. Alors,
thank you very much, Mr. Chair. I have the honor of providing you a summary of the document AFR/RC68/12, which has as its title Draft WHO Global Strategy on Health, Environment and Climate Change, and it has a subtitle, The Transformation Needed to Sustainably Improve Lives and Well-Being Through Healthy Environments. The reason which led the Secretariat to propose this document is threefold. First of all, it is the heavy burden which the environment also brings to disease. We know that 63% of diseases all over the world have to do with an unhealthy environment, and this causes 30 million deaths per year, and these deaths have to do with direct climate factors such as, for example, climate change, as well as extreme climate events such as, for example, flooding, cyclones, droughts, prolonged droughts, which create direct deaths, as well as problems linked to modifications and transmutations of the diseases. And here we have vector-borne diseases such as, for example, cholera, as well as malaria. And then we have diseases that are linked to the pollution of the air and unhealthy environments and air that we live in. And hence the reason why this document was therefore requested. The second reason why I want to submit this has to do with the change of the global arena. You will know that as a result of the adoption of the Sustainable Development Goals, the environment has changed, and it is needed, or it is important for us to adopt a more integrated approach in order to better manage all the factors related to health. And then there is another issue, and that has to do with the fact that there are specific actions that have been adopted by member states to better manage climate change. And so we have the 2063 agenda of the African Union, which focuses on that. And then the last reason is the fact that the WHO Secretariat has also adopted various reforms that need to be carried out, and these are included in the 13th General Program of Work. We have the transformation agenda that was adopted by the Director General of the WHO, and they created a task group in order to support the implementation of all these measures. So this document was prepared, it was coordinated at world level by Geneva, and so with the permission of the chairperson, I'd like to give the floor to my colleague Dr. Boramaso. He is from the Department of Climate Change and Health in Geneva, so that he can summarize the most important aspects of this document. Yes, I agree, says the chairperson. Thank you very much, Mr. Chairperson.
The draft WHO Global Strategy on Health, Environment and Climate Change has a vision. A vision is a word in which sustainable development has eliminated the almost 1/4 of all death and disease burden worldwide caused by avoidable unhealthy environments through health protection and promotion, preventive action in relevant sectors, and healthy choices, and which manages new and emerging environmental risks to health. Key sectors fully integrate health into their decision-making process and maximize societal welfare. What are the key elements of the strategy? This draft global strategy has 6 major priority interventions. One being primary prevention. Primary prevention to scale up actions on health determinant for health promotion and protection in the 2030 Agenda for Sustainable Development. By 1, engagement for massively expanded primary prevention. 2, integration of action on primary prevention and disease programs. The second major element of this strategy is actually cross-sectional action, multi-sectoral approach to address determinant of health in policies in all sectors and ensure healthy energy, transport, and other health-determining transitions. By 1, systematic consideration of health in the development of health-relevant policies beyond the health sector. 2, gaining the health core benefits of more sustainable policy choices. The third major action is strengthen health sector. To strengthen the health sector leadership, governance, and coordination role by investing in the capacity of the health sector to engage in policies with other sectors, stepping up health sector effort to reach out to other sectors for health protection, and lastly, essential environmental services in healthcare facilities and greening the health sector. The fourth major element is building support. To build mechanisms for governance and political and societal support. By 1, strengthening the governance mechanism to allow sustainable health protective action. 2, stepping up demand and leadership for health. And thirdly, building high-level political movement and agreement. The 5th major priority intervention is new evidence is needed to generate and provide the evidence based on risk and solutions and efficient communication to stakeholders to guide choices and investment. This will be achieved by continued integration of environmental monitoring and health surveillance to evaluate the health impacts from environmental risk and services. 2, continued development and evidence-based guidance to support effective action at the national and subnational level. Thirdly, interpretation and targeted communication of data and evidence. Fourthly, mechanism and capacity for early identification and response to emerging threats. Fifth, shaping research and driving innovation. And sixth, building the case for adequate funding allocation and influencing investment. The sixth and last major priority intervention is monitoring. Monitoring to guide actions by monitoring progress toward the Sustainable Development Goals. This will be achieved through monitoring of progress toward the Sustainable Development Goals and other indicators, monitoring change and implementation of relevant strategies at the country level. Mr. Chair, this strategy aims at transforming the way we tackle environmental risk to health by building health in all policies to prevent disease and promote health, supported by a strengthened health sector, adequate governance mechanism, and scale-up communication to create a demand for health environments. It responds to the persisting 1/4 of all death and disease burden worldwide caused by the environment and increasing challenges such as climate change, unplanned urbanization as just discussed, and air pollution, among others. Thank you, Chair.
Thank you very much. Mr. Chairperson, we would like to request the Regional Committee to analyze the draft on the strategy for the WHO Global Strategy on Health, Environment and Climate Change, and to make comments, because this is going to be submitted to the Executive Board at its 144th session in 2019. Thank you very much. I would like to give the floor to the delegates to formulate and make comments and inputs on this document. Gabon and then Mozambique can get ready. I don't know if the RCA wants to take the floor. Your board is up. Thank you very much, Mr. Chairperson. Mr. Chairperson, dear colleagues and delegates, Gabon would like to thank the Secretariat for the quality of the document that has been submitted, which focuses and defines on the various strategies that need to be taken in order to give a response to health, environment and the climate change, and that focuses on the focus which the WHO is giving to this issue. I think that it is important for us to take note of the fact that climate change does have an impact on health, and environmental risks can in fact be a risk to human health. I'm not going to go into detail with regard to this, but we have, for example, natural disasters. We also have the various climate change consequences and many other risks that come from anthropogenic activities. Gabon organized in Libreville in 2002 a conference on health and the environment, as well as consequences of the degradation of our environment on human health. And I believe that altered climate in fact does have an impact on the morbidity and mortality rates. And since the last conference that took place in 2008, the President of the Republic organized a high-level task force to ensure that 15% of our forests can be reconstituted so that we can ensure that we rebuild the ozone layer. And they've also instructed for the mapping of the results of climate change. We've also, and so Gabon supports the draft WHO Global Strategy on Health, Environment and Climate Change that has been presented by the Secretariat. However, we'd like to invite the Secretariat to consider environmental surveillance as an important strategy priority. And finally, I would like to inform that Gabon is going to host in October the Interministerial Conference on Health and Environment, and the theme is Strategic Alliance and the Environment, a catalyzer for development in Africa. So I'd like to invite all our colleagues and the delegates from Africa, as well as the international partners, to participate in this conference, which is being organized by the Gabonese government together with the WHO, as well as the World Programme for the Environment. And the objective is to formulate policies and ensure better investment for the environment so that we can attain the Sustainable Development Goals in Africa. This is the announcement that I would like to make. Thank you very much. Thank you for your invitation. And now I'd like to give the floor to Mozambique. Thank you very much, Mr. Chairperson. Allow me, first of all, to congratulate the Secretariat for including this topic on our agenda because of the fact that it is very pertinent. It is a very important topic, and Mozambique, which is one of the countries that is most vulnerable in the region to natural disasters and almost regular natural disasters, either due to floods or prolonged droughts or tropical cyclones or heat waves. So we are susceptible to all of these. So Mozambique is very much aware of the situation, and I'm sure that all of you will remember the historical floods that affected 4.5 million people in our country, of which 6,999 lost their lives. So this was followed by a generalized cholera epidemic, and so we are very aware of the problems related to the environment and its impact on health. Just to give you a history, Mozambique elaborated the environmental strategy, which includes an assessment of all health risks that result from the environment, and we developed various actions to ensure a resilience to environment. We also created an Environment and Health Observatory within the context of the National Health Observatory, and it has been functioning since 2016. It also established a Emerging and Recurrent Diseases Observatory in 2012. So we would like to use this opportunity not only to recommend the approval of the document, reiterating our congratulations for the fact that it has been put on the agenda and presented, but also we'd like to request the WHO to take into consideration the challenges which member states face, more specifically Mozambique and other countries that face similar problems, because they need to create the necessary technical skills skills and competencies to respond to the challenges resulting from the problems of climate change. They also need the necessary technological knowledge, and we also need to strengthen the surveillance capacities of our staff so that they can better understand the epidemics that result from climate change. Chairperson, thank you very much. Thank you very much. I'd now like to give the floor to Tanzania.
Thank you, Chairperson. Tanzania takes note on the draft comprehensive global strategies on health, environment and climate change to be considered in the next World Health Assembly in May 2019 and through the Executive Board at its 144th session in January 2019. We appreciate the scope draft in the global strategy aiming at responding to the known and avoidable environment, health, risk and challenges. We have also noted in the draft strategies that there is a clear indication that environmental integrity has an important influence in human health and development. Chairperson, we propose the integrated population, health and environment approach be promoted as it acknowledges and addresses complex connections between humans, their health, and their environment. Such an approach is important because it is holistic and cost-effectively addressed the multifactorial nature of humanity needs rather than the traditional single sectors approach. Chairperson, on page 15 of the draft strategies under Enhance WHO Direct Impact in Countries, item J, we recommended that the provided list of the vulnerable population should be removed. The list is not exhaustive, which could be misleading. The sentence should be read, provided enhanced exhaustive support to populations in vulnerable situations according to their natural nation context. Chairperson, in conclusion, while Tanzania supports the draft strategies, including suggested amendments, we further propose that more refining of the document be done to minimize repetition in some areas of the draft document for it to be more precise. Thank you.
Thank you very much.
We would now like to give the floor to Kenya, and we will close with the intervention by Kamors.
Thank you very much, Mr. Chairman. Kenya also adds its voice to those countries that have supported this draft document on health, environment, and climate change, with the realization that this is a problem that is facing almost all the countries in Africa. And we do appreciate particularly the expanded partnership that is coming on board, and with the particular emphasis also on collaboration across the other SDGs. So, Chairman, Kenya, the issue of climate change is, in Kenya, is very dear to us because we have seen the emergence and re-emergence of diseases such as malaria in areas where we didn't expect them to be, also chikungunya, and so we do believe that the issue of climate change is a reality that is already here with us. As a country also, we have experienced catastrophic disasters arising from floods, and of course with all the attendant risks and consequences, like the risk for outbreaks of infectious diseases. Of course, while noting that this is a draft document, we would like to strongly encourage the Secretariat to have a stronger emphasis on urbanization, not just as a principle or as it comes out in this document, but having acknowledged that Africa is rapidly urbanizing, and recognizing also that even looking at the 12 goals that we have set out in this document, it's very clear that in urban areas and cities is where you have the largest populations of people. That's where you have the highest levels of pollution. That's where you most likely also would have the most devastating impacts of climate change, including flooding. In urban areas and cities is where you would really have challenges around water and sanitation. The effects of potential exposure to chemicals, hazardous chemicals, and also radiation safety would be the greatest, as well as the rapid transmission of highly infectious diseases would mostly impact the urban areas. And so we'd like to urge the Secretariat to provide a greater emphasis on the issue of urbanization and actually elevate it to either a program or a sub-program within the broader draft framework on health, environment, and climate change. And so, the Chair would like to emphasize on that. In the recent past, Kenya has taken very significant steps towards combating issue of pollution. We have implemented a complete ban on some certain categories of plastics, and we have been able to monitor that very successfully. It's one of our most successful policy initiatives in the recent past, and we have visibly seen a huge difference in terms of pollution. And so we'd like that even as we move towards improving this document and eventual implementation, our call to all the countries of Africa and to the Secretariat is to continue the advocacy for plastic ban so that we take a common approach as a region. Because again, we've seen that when we do these bans in isolation, because again of movement of people and trade, you could still have plastics coming into the country from neighboring jurisdictions, and therefore having a common approach to this issue to us will go a long way in terms of implementing our draft strategy on health, environment, and climate change. And finally, Mr. Chair, would like to also encourage in this document that the use of technology be amplified. We do know that in terms of tracking, whether we are tracking weather events together, of course, with meteorology, whether in terms of tracking patterns of movement of vectors of diseases, or tracking evolution or emergence and reemergence of new vectors, the use of technology, geographical information systems is going to be very important moving forward. Otherwise, we, as I conclude, just to say that as a country, Kenya, we will be available and committed for further input to this document, because again, we do know that we have to invest now so that we can protect future generations, so that future generations can enjoy and thrive in this planet. Thank you, Mr. Chairman.
Thank you very much.
Muito obrigado. Thank you very much. Kamoz.
Merci, Monsieur le Président.
Thank you very much, Mr. Chairperson. The Union of Comoros would like to congratulate the Secretariat for the quality of the report that has been submitted. The WHO Global Strategy on Health, Environment and Climate Change is an important document, and the Union of Comoros, since it is part of the small insular developing states, has to intervene in this matter. Chairperson, the Union of Comoros, after having analyzed this strategy on health, environment and climate change, would like to make the following comments. First of all, in paragraph on the challenges, paragraph 4, where it talks about the impact of environmental changes on people's health and well-being. It's important to say that climate change has got direct and indirect impacts on health. The direct impacts have got to do with malnourishment and undernourishment, and an increase in mortality and morbidity linked to extreme climate changes, for example, heat waves and waterborne diseases, as well as vector-borne diseases. And then we've got the indirect impacts that have to do with the reduction of availability of water, the floods, and so forth. And then in paragraph 6, it has to do with the strengthening of the health sector. It says reinforcing governance and leadership and the role of the health sector. And then in subparagraph E, invest in the capacities of the health sector so that they can better collaborate with other sectors. I think it's important to highlight the fact that we need to develop approaches that can strengthen our resilience to climate change through various instruments and support linked to the environment. And then we also need to link this to strengthening capacities for the reduction of risks, which is in paragraph E. And then where we talk about new evidence in order to better understand the risks, is it better for us to be able to effectively communicate with all stakeholders so that we can guide investments properly. And then subparagraph 5, we need to guide investment and stimulate innovation. And here we'd like to propose that it's important to say that there's a need to strengthen research and investigation capacities of all countries so they can better understand climate change and contribute to the development of evidence and educate the public on prevention through education and training interventions. Thank you very much, Mr. Chairperson. Malawi, it seems that you have your plug up. Would you like to take the floor?
Thank you very much.
Yes? Okay, you have the floor.
My comments short. Malawi supports the draft the WHO Global Strategy on Health, Environment and Climate Change. I fully agree that environmental integrity has an important influence on human health and development. And I want to emphasize here that one resource that Africa has a lot of, but is grossly underutilized, is the sun. The sun will answer our problems in air pollution, our problems in water and sanitation. So as WHO, I feel we need to advocate for the reduction in the pricing of all commodities that will help us to generate energy from the sun. And this will help us it will go a long way in helping us to reduce some of these problems here. I know that some of these products are very expensive, but if we advocated for a reduction in the taxes and everything, it would be so affordable that most of the health problems that we're facing now would actually be reduced in a way. That's the only little comment I had, and thought that could be included somewhere in this document. Thank you.
The last, not the least, Angola.
Merci, Monsieur.
Thank you, Chairperson. Chair, Angola congratulates the initiative of the WHO Secretariat in opening discussion on this global strategy on health, environment, and climate change in accordance with the decision of the Executive Board at its 144th session, and strengthens the need for cooperation amongst member states with a view to obtaining the results and subsidies in order to take the necessary decisions to deal with the challenges related to environment and health. Angola agrees on the need to change the approach in managing environmental challenges as they relate to health and the well-being of the populations. Many actions have to be prioritized and strengthened. Governance mechanisms and capacity of the sector, of the health sector, are targeting cross-sectoral actions, as well as dynamizing the committees to combat epidemics, which involve the ministries of environment, energy, water resources, etc. The new vision of the health sector is a multi-sectoral approach, and so Angola started preparing national environmental health policies. And some of the things we envisage as priority actions are to promote partnerships and social movement mobilization in favor of the environment, multilateral agreements on health and environment in line with the declarations of Libreville and Luanda. So we agree and support the proposals contained in this document. Thank you, Chairperson.
Merci beaucoup.
Thank you. I don't know if the Secretariat has something to add. Thank you, Chairperson. The Secretariat has taken note of all the comments, which are all very pertinent and constructive. We commend the delegates for these contributions, which will certainly help the Secretariat to improve the quality of this document on the basis of the priorities mentioned here. We also wish to seize this opportunity on behalf of the WHO to thank Gabon for its high-level leadership on the matter of health and environment, and especially for having accepted to host the 3rd Interministerial Conference on Health and Environment. Their consent to include environmental surveillance will be taken into account in the document. Coming to Mozambique, I think it was basically constructive comments, especially with regard to capacity. And we note with satisfaction that this year Mozambique used the Forum on Human Resources, and the theme was human resources in the face of the challenges of climate change. This again demonstrates the commitment of this country to tackle and take on board the dimension of health and environment. Capacity building and the definition of skills is part of the priority axis. We note also the comments from Tanzania with a view to fine-tuning the document by reducing some of the redundancies contained in it. We have noted Kenya's concerns as well. Urbanization is a key point, and we will take this into account. Also, in terms of its effect on environmental and social determinants of health. We shall also take into account the use of technologies, not only to collect information, but also technologies that are resilient to climate change, because this is an important element of this strategy. We have taken due note of the comments from the Comoros as well, and we shall make the necessary adjustments in line with those proposals. On the issue raised by the distinguished delegate from Malawi, yes, one clear dimension is to reduce air pollution, and to do this, there is need to reduce the use of biomass as a source of energy, because it not only creates conditions of pollution, but it also exacerbates the ozone layer, as well as climate change, especially in countries that don't have forests. So one key element would be to promote clean energy. We shall also develop this in the strategy. This means that to address the problem of domestic energy, there is need for intersectoral collaboration between the Ministry of Health and the Ministries of Environment and Energy and Water Resources. Again, the key word here is intersectoral collaboration. So we have taken note of the request of Angola, which is putting in place a national strategy on health and environment. With the permission of the chairperson, I will give the floor to my colleague, Dr. Sambo, for additional information.
Thank you, Chair. I think Dr. Magaran has responded to individual questions. And as he stated when he took the floor, this draft strategy was presented to the regional committee to get input. So everything that honorable ministers or head of delegation has mentioned is very well noted, and it will help us improve this document to be presented to the next EB. Thank you, Chair.
Thank you. Merci. Merci beaucoup.
Thank you. Distinguished delegates, thank you for your discussions pertaining to this agenda item. Shall we take it that the Secretariat has taken note of the views expressed during this meeting, which will be considered in the updated version of the global strategy to be presented to the 144th session of the Executive Board in January 2019? It is so decided.
D'accord. Et nous voici arrivés à...
We have now come to the end of today's session. We would like to invite the Secretariat to give us announcements, if any. Otherwise, we shall meet tomorrow at 9 o'clock.
Indeed, we have 3 announcements to do. Ministers and head of delegations who did not receive their gifts yesterday evening are kindly requested to contact the Secretariat. Second point is that there is still a telephone announced lost. So apparently it was found, but we don't know to whom it was returned. It was apparently returned, but we don't know exactly to whom. So the person who has found a telephone, please return it to the Secretariat. Concerning side events, we have one side event this evening. Right after the session, delegates are requested to proceed to room BC12. The side event is on tackling the burden of hypertension and strengthening the management of severe NCDs through public health approach. Tomorrow morning there is a ministerial side event in the Green Room from 7 to 8:45. Thank you very much.
Merci beaucoup.
Thank you. So, have a good evening and see you tomorrow morning.